Hello, good evening. I'm Dr. Miskoff, Jeff Miskoff, and it is March 16th, 2020 at 8:48 p.m. Here in good old New Jersey. And I am a critical care doctor that has now been placed into the front lines in regards to coronavirus and COVID-19. And I felt it was necessary to record and log on a daily basis experiences that I'm having, of course, leaving out any direct patient information or, being HIPAA compliant, if you will. So with that said, I did spend an entire day in an intensive care unit with, I believe, 6 patients at one point being ruled out for COVID or coronavirus, COVID-19. And at the end, we did get one back that was negative, thank goodness. However, there is still multiple patients in the hospital with concerns and showing a similar type of abnormality on imaging, more specifically a bilateral pneumonia process. On CAT scan, what we call ground glass opacities, an inflammatory pneumonitis, and again, a direct cause from the coronavirus. It's unclear exactly what predisposes certain patients to get it or get it more severely. Today, we were given an algorithm to start all patients on a medication pending the rule out for the coronavirus. Unfortunately, it is taking several days at least to get the results back. So patients are remaining isolated and in the intensive care unit, not moving, and really, isolated from their families. Families are only allowed in if it's a end-of-life issue. So it's really just the healthcare providers there taking care of these patients and trying not to send them for testing if it's not 100% necessary. Where previous to corona, we would need a CAT scan or a test, off they went, and now much more caution and consideration in doing the test, which I think is interesting. And it'd be interesting to look back on it and see, how fewer amount of tests were done during this time period. And so much more to look at. Again, we are giving patients bilateral pneumonia, really an anti-malarial drug called hydroxychloroquine, which is generic, and this is started at 400 milligrams twice a day pending that rule out. If they're negative, they come off the drug. If they're worse and they're ending up on mechanical ventilators, our protocol is to, it's not a protocol, it's a consideration for even higher level medicine, whether it be a compassionate medicine from a pharmaceutical company, and we do have one in that regards, or considering really what we used for HIV, antiretrovirals or heart medications, or even taking it further, for example, in one patient giving an anti-interleukin 6 medication, again, what you would see more in the hematology oncology world. So, really being aggressive up front with these patients as we wait for a treatment, an official treatment, an FDA-approved treatment, and rather going off-label right now and using these medications in an effort to hopefully shut down the virus, not really understanding these medications outside of the test tube, but knowing that it does something to the virus and likely at the RNA level. So considering them early and actually doing it now with this medication as mentioned. So much more to learn, and I don't usually record these types of things and post them. However, again, I felt it was important to share this information, and we'll get more detailed as the days go on. Of course, everybody stay healthy, stay clean, and good hygiene. Wash those hands, and fortunately, we're learning a lot about the safety and the protocols. And tomorrow, in fact, I'll be going to a quick tutorial on how to gown up and glove, and hopefully share that with you. And unfortunately, I was never able to grow a good beard or facial hair, and now men are being told to shave theirs off so that the masks fit tight to prevent infection. And that's just one thing that can be done to help spread the coronavirus. Of course, now that I touched my face, I will go clean aggressively at the sink for at least 20 seconds. So stay healthy, stay well, stay away from coronavirus, stay inside for now, unless you really have to go outside. I went up to pick up a couple prescriptions, and it was crazy how many people were still out, grabbing those last couple bottles of water. Really unnecessary and unsafe. So I think there is still plenty to go around for everyone. Have a good night, and again, be well. Thank you.